Think about how much time you actually spend inside.
Mm.
Your home, your office, schools, shops, it adds up to maybe, what, 90% of your life?
Easily. Sometimes more.
And how often do you really stop and consider the air you're breathing in all those places?
Well, for most of us, before 2020 anyway, probably not that often.
Right. It likely wasn't top of mind.
That's right. Historically, our relationship with indoor air was pretty simple. Is it comfortable? Does it smell okay? Are we hitting those minimum standards?
Yeah.
It wasn't really seen as a fundamental public health variable.
But that has changed
Yeah.
dramatically. Suddenly, indoor air quality, IAQ, it's everywhere. You can't avoid it.
Mm-hmm.
And that's what this deep dive is all about. We've been unpacking a stack of source material straight from a major IAQ conference and workshop.
Yeah, featuring leading global experts. It really gives a current snapshot of how the field is evolving.
Totally. New standards, the latest on health impacts, technologies.
All of it. How we tackle these challenges.
So our mission here is to cut through the noise, pull out the most important, maybe surprising, and frankly actionable insights shared by these experts.
Right.
We want to help you understand the fundamental shifts happening in how we think about and manage the air inside buildings. Okay, let's unpack this.
Okay. And what's truly fascinating is that shift in the worldview of IAQ itself.
Yeah.
For decades, like you said, the focus was largely on, thermal comfort, controlling odors,
Right.
and meeting those minimum outdoor air ventilation rates.
Yeah.
Often set by standards like ASHRAE 62 or Australia's AS 1668.2.
Right. Those standards were good for, preventing stuffiness, managing basic air freshness, but they had a critical blind spot.
Exactly. The pandemic exposed it starkly. Existing standards just weren't designed with infectious aerosol transmission in mind.
Ah, okay.
They didn't really account for the risk of those tiny airborne particles, carrying pathogens floating around and building up indoors.
Which revealed this major public health vulnerability.
Huge, especially in places that weren't hospitals, offices, schools, restaurants. They just weren't set up for that kind of threat.
And that vulnerability, it spurred a direct, pretty rapid response from experts globally.
Mm-hmm.
This is where ASHRE Standard 241 comes in, right? The control of infectious aerosols, one.
That's the one. And it's being described not just as like an update, but a truly transformative step.
Transformative how?
Well, it aims to set minimum, legally enforceable requirements for actually reducing airborne disease transmission. The key thing is it applies across a whole range of buildings.
So not just hospitals anymore.
Exactly. Extending that critical focus beyond healthcare. Dr. Max Sherman, who co-chaired this standard and is a big name in IAQ research, he really emphasized its importance at the conference.
Okay.
It's a clear signal, really. We need to actively manage the air we share to cut down health risks from pathogens.
Now, when we talk about managing air quality, especially for ventilation and maybe infection risk, a lot of the talk, and there was significant debate at this workshop, centered around CO levels, carbon dioxide.
Yes, absolutely. And traditionally, high CO is mostly seen as an indicator of poor ventilation, stuffiness, comfort issues.
Yeah.
But the new paradigm, especially within Standard 241, it leverages QOOs for a different, much more critical purpose.
So it's more than just a comfort metric now. Is that the idea?
Much more. It's being used as a practical proxy.
A proxy for what?
For gauging the level of human exhaled air in a space. Think about it.
Yeah.
We breathe out CO, right?
Right.
But if we're sick, we also breathe out infectious aerosols. So higher QOO suggests there's more exhaled air compared to fresh outdoor air dilution.
And therefore potentially a higher concentration of airborne pathogens if someone is sick.
Precisely. So monitoring QOO becomes a relatively simple, scalable tool for infection risk management. Dr. Max Sherman's work strongly supports using QOOs in this way.
But you mentioned debate. And there was quite a bit around specific targets, wasn't there? Like the 800 ppm benchmark.
Yes, definitely. We heard different viewpoints, like from Dr. Sherman and Professor Lydia Maraska. It highlights the challenge, really.
How so?
Setting thresholds that are protective enough, but also, practical for all sorts of buildings to actually achieve.
Right. It's a balancing act.
It absolutely raises that important question. Balancing ambitious health goals with real-world implementation.
But, regardless of the debate over the exact number,
Mm-hmm.
the core insight is still there. Monitoring OCOR gives you a useful indicator, something you might see or even use yourself to get a quick read on ventilation and potential risk indoors.
Okay. So moving beyond just infection risk, though, the sources really hammered home that the harm from poor IAQ is, much broader. often chronic,
Yeah.
which led to this concept highlighted as really crucial, the harm paradigm. This is a fundamental shift. Dr. Max Sherman explained it compellingly. It moves away from just saying, okay, this pollutant level is X, and that's above limit Y.
Right.
Instead, it asks, what is the actual health harm being caused by the mix of contaminants people are breathing indoors day in, day out?
How do they measure that? The harm. This sounds a bit abstract.
They use population health metrics, things like disability-adjusted life years or dailies.
Dailies. Okay.
Think of a daily as one lost year of healthy life. It combines years lost to premature death and years lived with disability or illness.
Ah.
By applying this to indoor air exposure, experts can measure the total burden of disease from indoor pollutants. And crucially, prioritize which contaminants need the most attention based on their real impact on population health.
That sounds like a much smarter way to focus efforts, right? Where they actually matter most for public health.
Exactly.
So what are some of the key findings when you look at IAQ through this harm paradigm lens? What did the experts say?
Well, the findings are pretty stark, actually. Chronic exposure to common indoor pollutants isn't just causing, like, minor irritation.
Yeah.
No. We're talking about pollutants like fine particulate matter, PM2.5, those tiny particles you can't see, from cooking, traffic smoke getting in, wildfires.
Yeah, the really nasty stuff.
Right. And nitrogen dioxide, NOx, maybe from gas stoves or attached garages, formaldehyde from building materials, furniture, radon, that natural radioactive gas, ozone.
Which can drift inside or come from equipment.
Exactly. The research suggests these indoor exposures account for a really significant chunk of the global disease burden.
Oh, significant.
Potentially up to 7% of the total burden from all diseases worldwide.
7% from indoor air. That's
Right.
huge. That really elevates IAQ, doesn't it? From just comfort to a major public health issue.
Absolutely. And the sources detailed specific links too. SO Prof. Paul Wargocki discussed potential negative impacts even from relatively low KIO levels on, say, cognition and productivity. Mark Jones highlighted the risks of low humidity. Dry air can dry out our respiratory passages, make us more susceptible to infections.
It affect thinking, too.
Potentially cognitive function as well, yeah. And Dr. Shelby Berg and Jeremy Stamkos pointed out a tricky issue with modern buildings.
What's that?
We're building them more airtight for energy efficiency, which is good in theory. But if we don't manage moisture properly inside those tight envelopes, it can lead to mold growth. And that has significant respiratory and other health consequences.
Problems.
Exactly. And Plumstone from the Safer Air Project brought up a critical point about equity.
Which was?
That poor IAQ disproportionately harms vulnerable populations, people with chronic health conditions, for instance. So ensuring safer shared air isn't just a health issue, it becomes an accessibility issue too.
Right. It's about equity.
It really reframes buildings, doesn't it? From just static boxes to dynamic environments that directly impact health and fairness.
Okay, so with this clearer picture of the harm, what about solutions? What strategies are emerging? The sources talked about a necessary shift in approach.
Right. Historically, the go-to solution was often just dilution. Bring in more outdoor air.
Open the windows wider, basically, or
Yeah.
crank up the ventilation.
Exactly. But as Ben Gill explained, while that can improve air quality, it's very energy intensive.
Ah, yeah. Heating or cooling all that outside air.
Takes bigger HVAC systems, uses more power, costs more money, and frankly, it works against our climate goals, our decarbonization efforts.
So the focus is shifting towards decontamination. Is that the term?
That's the idea. Cleaning the air within the building envelope, using things like advanced filtration, maybe other technologies like UVGI.
So clean the air that's already inside, rather than just replacing it constantly.
Precisely. This can be much more energy efficient while still effectively removing particulates, pathogens, other contaminants. It's about getting good air quality without that huge energy penalty from excessive ventilation.
Makes sense. And filtration itself was a big topic, right? Especially this new Australian standard, AS16890, which aligns with the international ISO 16890.
Yes, and Daniel McCaffrey and Philip Schluter really detailed why it's such an improvement over the older AS324.
How's it better?
Well, the old standard used a, let's say, cruder method based on just counting particles in broad size ranges. The new one, a CISO 16890, gives a much more accurate picture of a filter's real-world performance.
Specifically.
Specifically, its efficiency at capturing particulate matter PM. especially the really harmful PM2.5 particles, the ones that get deep into your lungs.
So you know exactly how well that filter is actually working against those dangerous fine particles.
Yes. And the goal isn't just maximum capture at any cost. They stressed optimizing filters
How?
to get the best PM removal while minimizing the energy the fan needs to push air through the filter. It's a crucial balance between clean air and energy efficiency.
Okay. The conference also dug into IAQ issues in specific places, like homes. Joel Seagren presented research on range hoods.
Yeah, that was interesting. Showing the big difference between the recirculating ones, that just filter and blow the air back into the kitchen,
Right, most apartments have those.
versus the ones that actually vent to the outside. Especially for removing PM2.5 generated by cooking,
Yeah,
that external vent makes a huge difference.
good to know. And what about the building itself? Construction issues.
Yes, William Lane highlighted how poor installation of HVAC systems can totally undermine their effectiveness, even if the design is great on paper.
Right. If it's not put in right.
It won't work right. And similarly, Teresa Branch talked about thermal bridging.
Thermal bridging.
Yeah, those spots in the building envelope where insulation is interrupted, like metal studs or concrete connections. They create cold surfaces inside.
And that leads to?
Condensation. Moisture, which can foster mold growth in places you can't even see, like inside walls, even in a building that feels sealed and efficient otherwise.
Wow, so these hidden flaws can create real IAQ problems.
Absolutely. And we also heard about other things like Dino Pizzaniello discussed managing body odor using ventilation or purification. And there were panel discussions on optimizing IAQ, specifically with split system air conditioners, too.
Right.
It just reinforces that IAQ solutions need to be integrated. You have to look at the big central systems, but also the specific appliances, the construction details, everything.
And of course, you can't manage what you don't measure. That came up a lot. Monitoring IAQ sounds simple, maybe by a sensor, but Jeremy Stamkos pointed out it's more complex.
Well, definitely more nuanced than just glancing at a number on a little display.
Yeah.
Dr. Claire Bird and Jeremy Stamkos discussed the trade-offs, relying only on real-time, often lower-cost sensors versus traditional, more precise lab testing. If you just rely on proxy parameters like QO or VOCs from a cheap sensor without really understanding what they mean or their limitations, you can be misled.
But there's a lot of innovation happening in monitoring, isn't there?
Well, absolutely. Some really fascinating approaches were discussed. Savinda Lacombe talked about integrating low-cost PM2.5 sensors into everyday devices.
Like what?
Like smoke alarms.
Yeah.
Making monitoring potentially much more accessible and widespread.
Never.
And Mohammed Mahmood presented work using aerosol measurements combined with CFD simulations.
CFD, computational fluid dynamics.
Wait.
Like computer modeling.
Exactly. Computer modeling of how air moves. To get real-time assessments of infection risk in a space and even visualize how things like HEPA filters are dynamically cleaning the air.
Wow, visualizing the airflow and how well filters are working in real time. That sounds incredibly powerful.
It really is. And then Henry Oswin shared research on using, get this, airborne respiratory microflora.
Microflora, you mean microbes?
Yeah, basically the microbes people are breathing out as a marker for poor IAQ. It's like a biological signal that can tell you something about air changes and how many people are in the space.
Huh. Okay. And stepping slightly outside the air itself, Dr. Richard Shaughnessy talked about surface cleanliness. How does that connect?
Well, he presented some intriguing research using ATP testing.
ATP.
Adenosine triphosphate. It's a molecule in all living cells, bacteria, mold, skin cells. Measuring ATP on surfaces gives a quick assessment of biological residue, basically how clean something is biologically.
Okay. And the link to health.
The research linked higher ATP levels on surfaces after cleaning in schools to higher student absenteeism due to illness.
Really?
Yeah. So it makes cleanliness measurable in a way that directly connects to health outcomes. A very practical metric.
That is practical. And for buildings just starting to look into this, Yi Cho mentioned simpler tools.
Yes. Preliminary assessment methods, like a semi-quantitative approach for offices, just to get a quick gauge of potential issues before diving into complex, expensive testing.
So there are entry points for everyone, basically.
It shows there are steps anyone can take to start understanding their indoor environment.
So bringing all this together, how are these insights, these technologies, translating into actual standards, policy, real-world changes?
Well, standards are clearly evolving fast. We saw updates like AS 1668.2.2024 in Australia, incorporating new IAQ thinking, alongside that groundbreaking ASHRAE 241, focusing on infectious aerosols.
And frameworks are emerging too. You mentioned the well building standard.
Yes, Jack Noonan discussed the well air concept. It provides a really comprehensive framework, integrating design, operation, maintenance, even occupant behavior.
And it connects IAQ to bigger goals.
Crucially, yes, well links IAQ performance directly to broader things organizations care about, like ESG, environmental, social, and governance. It helps make the business case, showing the economic and social benefits of investing in better indoor air.
Got it. And were there examples of actual projects, things happening on the ground?
Definitely. Daniel West shared insights from the Pathway to Clean Indoor Air project in Victoria, Australia, practical steps for public buildings. And Ching-E Cho presented Taiwan's approach,
What are they doing?
a multifaceted strategy, combining IoT monitoring using connected sensors with regulations, but also voluntary labeling programs to encourage buildings to improve.
Interesting. Using data and policy together.
Exactly. Noel Courtney really emphasized that growing role of data-driven strategies in HVAC management, using real-time monitoring, automated systems, not just for energy anymore, but to actively optimize IAQ, meet regulations, and improve well-being.
But it's not just about tech and data, is it? William Lane stressed the human element.
Absolutely critical. The role of skilled professionals, especially commissioning technicians.
They're the ones who check if the system works as designed.
Precisely. They ensure these complex systems, meant to deliver both energy efficiency and good IAQ, are actually installed correctly and performing as intended in the real world. Without skilled people, even the best tech falls short.
Yeah, that makes sense. You need the expertise to make it all work together.
It truly takes that combination. Updated standards, smart policy, effective tech, reliable data, and skilled human expertise to get to safer, healthier indoor air.
Wow. Okay, we have covered a massive amount of ground in this deep dive. It feels like we've gone from realizing indoor air is this major public health issue, not just about comfort, to seeing how standards like ASHRAE 241 and a CISO 6890 are fundamentally changing to deal with the risks. We've navigated debates around metrics like COU, explored that powerful harm paradigm.
We're focusing on health outcome.
Right.
Yeah.
Looked at the shift from just dilution to decontamination strategies, uncovered those hidden building problems, examined cutting-edge monitoring.
From sensors and smoke alarms to microflora.
Yeah, and seen how it's all starting to be put into practice globally, driven by data and, crucially, skilled people.
That harm paradigm really does stand out, doesn't it? As a guiding principle for where IAQ needs to go, focusing relentlessly on reducing actual health harm.
Absolutely. And it makes it so clear that improving IAQ isn't just, buying an air purifier or opening windows sometimes. It needs a systemic approach.
Yeah, involving updated standards, smart policy, capable technology.
And a fundamental shift in perspective from everyone involved: designers, builders, managers, occupants, and fates.
Which raises an important question for you, the listener, doesn't it? Given all this evidence we've unpacked, suggesting chronic exposure to indoor pollutants really contributes significantly to the global disease burden.
Yeah.
How does rethinking the air in the buildings where we spend, say, 90% of our lives, how does that fundamentally change your understanding of public health and maybe your own personal well-being?
It really shifts the focus, doesn't it? From the air outside being the main concern to the air inside being just as critical, maybe even more so day to day. So based on what you've heard in this deep dive, what's one small step maybe that you could take or perhaps advocate for in your own indoor environment, home, work, school, to improve the air quality you breathe every day?